Hello friends, welcome back to our YouTube channel Doctor's Corner. Today we are going to discuss about physiology of the blood pressure. So in this subject physiology, blood pressure is a very important topic. So in this short video today we are going to discuss about two important things: definition of the blood pressure, which includes systolic blood pressure definition, diastolic blood pressure, pulse pressure, mean arterial pressure, also the factors affecting the blood pressure. Factors affecting the blood pressure. So blood pressure itself is a very important topic in MBBS, not only in the subject physiology, but when you go to higher classes like pharmacology, community medicine, general medicine, in each clinical subject, blood pressure is a very important topic, and its applied aspect like hypertension or the increased blood pressure, or hypotension or decreased blood pressure, or other factors related to blood pressure like pharmacology or the drugs affecting the blood pressure. So if you understand the basic, then we will be able to correlate it clinically and treat the patients. So let us discuss and stick to the today's video's lecture to this topic, definition and factors affecting the blood pressure. In the next video we will discuss about the regulation of the blood pressure, which is very important 10 marks question. Okay, short term regulation, long term regulation. Before that, some basics about the blood pressure. Now first and foremost, what is blood pressure? So the definition of the blood pressure is the force exerted by the blood against any unit area of the vessel wall. So what is the blood pressure? Let me write here. So what is blood pressure? It is the force exerted by the blood against any unit area of the vessel wall. Okay. So now different textbooks of physiology will give the different definition. Lateral column of the blood, the force exerted by the lateral column of the blood against the vessel wall is known as blood pressure, or simply the force exerted by the blood against any unit area of the vessel wall is known as blood pressure. So let me draw this same thing. I will just draw a line diagram of a heart to describe this thing. So just a rough line diagram with 4 chambers of the heart. So as you are aware that heart is made up of 4 chambers. So right atrium, left atrium, right ventricle and left ventricle. Okay. So from the left ventricle, aorta will arise. Okay. Then arch of the aorta and descending aorta, and ultimately its branches. Anyway, so the blood which is present in this ventricles, left ventricle as well as in the right ventricle through the pulmonary artery. So this blood will be flowing through the main vessels, that is from this aorta to ultimately to all the parts of our body through its various branches. So arteries, various arteries and arterioles and capillaries, then again venules and veins back to the right atrium. So this blood which is flowing in this blood vessels, this will by the force of the blood, that is the force exerted by the blood against any unit area of the vessel wall, simply known as blood pressure. That is this column of the blood which is flowing in these blood vessels, okay, that will exert some force against the vessel wall. So that force is simply known as blood pressure. Hope the definition of the blood pressure is very much clear. So today's first objective is what is the definition of the blood pressure. Okay. Now this blood pressure is not constant throughout the cardiac cycle. You know, cardiac cycle is of 0.8 second duration, which includes two important components. One is systole, that is when the heart is contracting, systole, and diastole, that is when the heart is relaxing. Okay. So the maximum pressure exerted during the systole of the cardiac cycle, it is known as systolic blood pressure. Now this is one of the component of the blood pressure, systolic blood pressure. Now what is systolic blood pressure? It is the maximum pressure exerted during the systole of the cardiac cycle is known as systolic blood pressure. Okay. So its normal value is around on an average 120 millimeter of mercury. I am just giving a theoretical average normal value. Okay, not necessarily it should be always 120, however it will be in a range. Okay, we will discuss about that range and the supplied aspect, increase or decrease. Right now just theoretically believe that it is the normal value is 120 millimeter of mercury. Okay, now this systolic blood pressure depends on, or the factors which will affect the systolic blood pressure is cardiac output. Cardiac output. What do you mean by this? Cardiac output. See, it is the systolic blood pressure is a function of a cardiac output, or simply systolic blood pressure depends on the cardiac output. So, cardiac output is the amount of the blood ejected by each ventricle per minute. So, from the right ventricle as well as the left ventricle, each ventricle during the systole, okay, some amount of the blood is ejected into the ejected from the ventricles, that is in the from the left ventricle to the aorta and from the right ventricle to the pulmonary artery. So, that amount or the this one, the pressure, the maximum pressure exerted during the systole is known as systolic blood pressure. It will be around 120 millimeter. That is, it reflects the cardiac output. So, depends on the cardiac output, or it is a function of the cardiac output. Suppose cardiac output is more, so systolic blood pressure will be more, and vice versa, cardiac output is less, and then systolic blood pressure will be decreased. So, significance of systolic blood pressure, it indicates, or it is affected by the cardiac output. Now, similarly, during the diastole, that is when the heart is relaxing, during that phase of the heartbeat or during the cardiac cycle, the pressure exerted, okay, it is known as diastolic blood pressure. So, it is the minimum pressure actually. The maximum pressure exerted during the systole is known as systolic blood pressure, and the minimum pressure exerted by the column of the blood against the blood vessel wall during the diastole, it is known as diastolic blood pressure, and the normal value of the diastolic blood pressure is 80 millimeter of mercury. Okay. So, 120 is the systolic blood pressure, diastolic is the minimum pressure exerted during the diastole of the cardiac cycle. Okay. Now, what is the diastolic blood pressure, what are the factors, or diastolic blood pressure depends on what? So, it is dependent on total peripheral resistance. So, depends on the total peripheral resistance. Total peripheral resistance. So, if the peripheral resistance means resistance offered by these blood vessels to the flow of the blood or to the blood pressure. So, when suppose there is a vasoconstriction, that is the diameter of the blood vessels, like in atherosclerosis, plaque formation and all. So, if there is a diameter is reduced, then the peripheral resistance is increased. So, blood pressure will be increased, that is the diastolic blood pressure especially will be increased. Okay. So, diastolic blood pressure depends on the total peripheral resistance. If peripheral resistance, vasodilatation, if peripheral resistance is less, flow of the blood is more, and diastolic blood pressure will be yes. So, if there is a vasoconstriction, diastolic blood pressure will increase, vasodilatation, diastolic blood pressure will decrease. Remember that thing. Details we will discuss again in the regulation of the blood pressure and also in the cardiac output chapter. Okay. Right now, just we are concentrating on the definitions. So, the two important definitions of systolic and diastolic. So, generally blood pressure is written like this, 120 by 80 millimeter of mercury. So, numerator here indicates the systolic blood pressure and diastolic pressure is indicated in the denominator here like this. Generally, the designation is like this. Okay, blood pressure, which includes two important components, systolic and diastolic. Now, let us see some more important definitions related to this topic. One important thing is pulse pressure. Pulse pressure. What is pulse pressure now? So, pulse pressure is generally, it is a systolic, it is calculated as systolic blood pressure minus diastolic blood pressure, which will be equal to around 40 millimeter of mercury. So, however, it is in a range of 20 to 50 millimeter of mercury. So, systolic blood pressure minus diastolic blood pressure, that is 120 minus 80 millimeter of mercury. Okay. So, it determines the pulse volume. So, what is the significance? It determines the pulse volume, that is it determines or maintains the pulsatile nature of the blood flow, which is important for the tissue perfusion. Okay. So, now This pulse pressure further depends on two important factors. What are the factors on which the pulse pressure depends? One is stroke volume, which is very important, and second one is the compliance or the distensibility of the arterial tree. The compliance of the, or that means distensibility of the arterial tree. So, in general, blood pressure here means the pressure in the arteries. What we are discussing is the arterial blood pressure. So, these two important factors will affect the pulse pressure, stroke volume and the stroke volume. What is stroke volume? The amount of the blood ejected by each ventricle during each heartbeat. Remember, cardiac output is different, stroke volume is different. Stroke volume is the amount of the blood which is ejected by each ventricle by each heartbeat. It is around 80 ml. Okay, that is in each 0.8 second. Okay, so these are the two important factors, stroke volume of the heart and the compliance. So generally pulse pressure is approximately the ratio of the stroke volume divided by arterial compliance. So pulse pressure is stroke volume divided by arterial compliance. Okay, so it is systolic blood pressure minus diastolic blood pressure. And the third factor on which the stroke volume depends is the ejection from the heart during the systole. Okay, that is less important, but the stroke volume and the compliance of the arterial tree. Pulse pressure significance, pulse, it indicates the pulsatile nature or the pulse volume, it determines the pulse volume, or helps in the tissue perfusion. Adequate pulse pressure should be there. Now, the next important definition here is mean arterial pressure. Mean arterial pressure. Now, what is mean arterial pressure? As the name indicates, it is the average blood pressure. Now, average blood pressure, that is average of the arterial pressure measured by millisecond over a period of time. So, let me write down here what is mean arterial pressure. It is the average of the arterial pressure, measured millisecond by millisecond over a period of time. Okay, so over a period of time, that is the average blood pressure which is flowing in our blood vessels, that is the mean arterial pressure. Now, this mean arterial pressure is not the average pressure, it is highest plus lowest divided by 2, not the arithmetic mean. So, it is designated as mean arterial pressure is calculated as diastolic blood pressure plus 1/3 of the pulse pressure. Okay, let me just first draw a rough graph of blood pressure. Okay, so on this y axis, let me draw the blood pressure, and here is the time duration, it is the cardiac cycle on x axis. So, you know the cardiac cycle, the total duration will be around 0.8 second. How much is the total duration? Cardiac cycle 0.8 second. In that 0.8 second, majority is diastole and systole consist of only 1/3, that is around 0.3 second. If you remember the cardiac cycle, those who have not seen our video on cardiac cycle, please go to our playlist of our channel Doctor's Corner. In that you can view cardiac cycle. We have explained in English as well as in Hindi. So 0.3 second is the systole and 0.5 second is the diastole. So diastole duration is more. Okay, the heart will relax for the more time, for nearly roughly 2/3 is the diastole and 1/3 is the systole, that is 1/3 is the systole. Okay, now in the 1/3, that is during the systole, what will be the pressure? The blood will be running with a higher pressure, that is around 120 millimeter. So it will be, the blood will be with a pressure of 120 millimeter of mercury during the systole. But during the diastole, when the heart is relaxing, so it will be around 80 millimeter of mercury. Okay, so maximum time the blood pressure during the cardiac cycle, that is during each heartbeat of 0.8 second, so 2/3 will be 80 millimeter. Now we have to take the average blood pressure here, so we can't take 120 plus 80 divided by 2. So we want a average pressure during this cardiac cycle. So how much will be the average pressure? It is around 93 millimeter. How we calculate is, see, you can see here, this is the diastolic blood pressure is 80. So it is calculated as diastolic blood pressure, and see, extra amount volume is here, extra pressure is here. So it is not for the whole duration. Okay, diastolic blood pressure is for the whole duration of the cardiac cycle. So diastolic blood pressure plus systolic blood pressure is just for 1/3 duration. So 1/3 of the pulse pressure. Pulse pressure means systolic minus diastolic. So hope you got this. So diastolic blood pressure plus 1/3 of the pulse pressure, that is systolic minus diastolic, this one 1/3 part. Okay, so that's why the mean arterial pressure is diastolic blood pressure plus 1/3 of pulse pressure. Okay, so if we calculate it, it will be roughly around 93 millimeter of mercury. Pulse pressure is 40. Okay, so 40 divided by 3 will be roughly around 13 point something. The diastolic blood pressure plus is 80 plus 13, 93. So it is in the range from 90 to 100 millimeter of mercury. Okay, so mean arterial pressure indicates the perfusion pressure to the tissues. Okay, so this 4 important definition we are supposed to know in relation to the definition of the blood pressure, that is the today's objective. Systolic blood pressure, normal value, depends on the cardiac output. Diastolic blood pressure, normal value, depends on total peripheral resistance. Pulse pressure, normal value, and depends on stroke volume and compliance of the arterial tree, that is the distensibility of the arterial tree. So approximately it is the ratio of the stroke volume divided by arterial compliance. The mean arterial pressure, diastolic blood pressure plus 1/3 of pulse pressure, that is 93 millimeter of mercury. Okay, so these are the 4 basic definition you are supposed to know in relation to the definition of the blood pressure. Now, second objective of the today's lecture is factors affecting the blood pressure. What are the factors that will affect the blood pressure? Affecting the blood pressure, I simply I will write as BP. Okay, now there are many factors that will affect the blood pressure. So I'll just try to write a flow chart. Okay, details we will discuss in a video of cardiac output. So today I just want to tell you about this flow chart. See, blood pressure is directly proportional to cardiac output and total peripheral resistance, that is peripheral resistance simply. Okay, or total peripheral resistance. So see, blood pressure depends on cardiac output. COE here is cardiac output and peripheral resistance, total peripheral resistance, TPR. So if the cardiac output increases, blood pressure increases. Total peripheral resistance increases, blood pressure will increase. Similarly, cardiac output decreases, blood pressure decreases. Total peripheral resistance decreases, blood pressure decreases. Okay. Now, in turn, cardiac output depends on 2 important factors. One is stroke volume and heart rate. So cardiac output is stroke volume into heart rate. So details we will discuss the factors affecting cardiac output and in some other lecture of cardiac output. So any factor that will affect the stroke volume and the heart rate will affect the cardiac output and in turn affect the blood pressure. Now again, stroke volume in turn depends on many other factors like preload. Preload is nothing but the end diastolic volume, that is approximately around 130 ml. Okay, if time permits we will discuss that also. Then afterload, preload, afterload. Afterload is nothing but the peripheral resistance. Okay, and the contractility of the heart, myocardial contractility. Now stroke volume depends on these 3 factors. So see, so if we know the factors which will affect the stroke volume, these factors will affect the blood pressure. Okay, Similarly, total peripheral resistance is affected by two important factors, that is, one is diameter of the blood vessel, and secondly viscosity of the blood, okay, viscosity of the blood. Two factors that will affect the total peripheral resistance, two important factors. Okay. Now, so when you get a question on factors affecting blood pressure, you should remember this flow chart. Blood pressure depends on two important things, cardiac output and total peripheral resistance, right? So, cardiac output depends on stroke volume and heart rate. Any factors that will affect the stroke volume increases, blood pressure increases, heart rate increases, blood pressure increases, and vice versa. Okay. And stroke volume in turn depends on the preload, afterload, and myocardial contractility. What is preload? So, see this heart, in the ventricles, before the contraction some blood will be there. So, that amount of the blood which is remaining after the diastole, that is known as end diastolic volume, it will be around 130 ml. So, that blood or the amount or the volume of the blood will causes the stretching of this myocardial muscles, okay, or myocardium. So, this stretching of this muscle due to this blood which is already present before the contraction of the heart, before the systole, it is known as end diastolic volume, that is during the end of the diastole. So, according to Frank-Starling's law, the force of contraction is directly proportional to the initial length of the muscle fibers. So, due to this end diastolic volume of around 130 ml, it causes the stretching of this muscle, the initial length of the muscle fiber is increased. So, when the initial length of the muscle fibers is increased under physiological limits, remember under physiological limits according to Frank-Starling's law. So, under physiological limits, when this muscle fiber is increased, length of the muscle fiber is increased, and then the muscle contract, the force of the contraction will increase, and ultimately stroke volume, that is the volume which is ejected by the ventricle per heartbeat, that is will be more. So, see, if the preload is more, stroke volume will be more. Stroke volume is more means cardiac output is more. So simple. So, more preload, more stroke volume, more cardiac output. So, if more cardiac output, blood pressure will increase. So, what are the factors that will affect the stroke volume? One is blood volume. If the blood volume is more inside our body, if the volume of the blood is more, obviously end diastolic volume will be more, and stroke volume will be more, and cardiac output and the blood pressure will be more, and vice versa. If suppose blood volume is less, as in dehydration and all, so stroke volume and cardiac output and blood pressure will be less. So, these are the factors that will affect the blood pressure. So, other factors like increased venous return, then due to venoconstriction, sympathetic activity. So, all these things, thoracic pump, abdominal pump, we will discuss in detail about this in the chapter cardiac output. Okay. Right now, just concentrate this flow chart. Similarly, contractility, myocardial contractility, like positive inotropic agents like digitalis, okay, hormones like glucagon and caffeine, theophylline, and sympathetic stimulation. So, when the heart is contracting, the contractility of the heart or ventricular muscle is more, stroke volume will be more, cardiac output will be more, and blood pressure will be more. Similarly, if the heart contractility is less due to any disease or cardiomyopathies, then the stroke volume, cardiac output, and blood pressure will be reduced. Afterload is nothing but the peripheral resistance, as I already said you. Peripheral resistance is resistance offered by the blood vessels. So, these peripheral blood vessels, suppose there is narrowed blood vessels, okay, either due to vasoconstriction or due to some atherosclerosis. So, when their peripheral resistance increases, then afterload increases. So, afterload increases means the load against which the heart has to pump it, that is known as afterload. So, peripheral resistance means afterload increases means blood pressure against increases, especially the diastolic blood pressure. So, afterload also affect this. So, factors that will affect the afterload. Okay. So, now total heart rate. Sympathetic stimulation increases the heart rate, parasympathetic or vagal stimulation decreases the heart rate. So, when the heart rate increases, cardiac output increases and the blood pressure increases generally. But when the heart rate is alone increase, not there is simultaneously there is no increase in stroke volume, then the blood pressure or cardiac output will not increase. For example, suppose heart is beating 70 times per minute and it is pumping some amount of the blood, that is the stroke volume. Okay, if suppose heartbeat is more 130 times per minute and the amount of the blood is same, okay, then it will be beating more but it will be ejecting the same amount. So, ultimately the cardiac output will be same and the blood pressure will be not be increased. Okay, so heart rate also increases. So, under physiological conditions, so when the heart along with the like sympathetic stimulation, when there is increase in the contractility and heart rate, so stroke volume also increases, heart rate increases, venous return increases, then blood pressure also increases. Similarly, total peripheral resistance, diameter and viscosity of the blood. So, diameter of the blood will be decrease due to sympathetic stimulation, that is vasoconstriction, and it is dilated, that is vasodilation during the parasympathetic stimulation. Okay, the details we will discuss in the cardiac output and peripheral resistance. And the viscosity, that is the thickness of the blood, like polycythemia, increase in the RBCs, or hyperproteinemia, or hereditary spherocytosis, or decreased body temperature. So, that will increases the viscosity. So, viscosity when it is increases, it is increasing the total peripheral resistance, and total peripheral resistance means blood pressure increases. Simultaneously, similarly, anemia will decrease that viscosity. Okay, then so viscosity will be decreased, and hypoproteinemia, increased body temperature. So, then total peripheral resistance is decreased and blood pressure will be decreased. So, this is the general factors that will affect the blood pressure. So, in the today's lecture we have discussed about the definition and the factors affecting the blood pressure. So, stay tuned to us with us and subscribe our channel Doctor's Corner. We will be making such interesting videos, lectures on all the subjects of MBBS, not only on physiology. In the next video we will be discussing about the very important topic which will be asked repeatedly in the 10 marks in the theory exams of the physiology, regulation of blood pressure, where we will be discussing about the short term regulation, long term regulation, baroreceptor reflex, renin angiotensin aldosterone mechanisms, and the other mechanism which will control the blood pressure. Okay.